So we've heard plenty about technology and the enterprise today. But as much as tech alone makes the world go round, and we at Sapphire certainly believe that it does, we're a little biased, but we do, it's also true that transformational technologies cannot always reach their ultimate potential based purely on their intrinsic technical merits. There's always the tricky question of externalities. We only need to look at companies like Uber and Airbnb to clearly see that virtually across any industry today, the pace of technical progress is not always in line with that of regulatory and political structures. And few people can speak better to the government perspective on that than one of our next speakers, someone who was actually responsible for the tech strategy of the US government. From 2009 until 2012, Aneesh Chopra served as the first US Chief Technology Officer as a direct appointee of President Barack Obama. Aneesh is currently the president of NavHealth, an open data intelligence service. He's also the author of Innovative State, How New Technologies Can Transform Government. So clearly, Aneesh has a long list of credentials, but I think the most profound and meaningful one is that he's also been a guest on The Daily Show with Jon Stewart.
Oh, yes, of course.
And as if that wasn't good enough, Jon Stewart has repeatedly referred to him as the Indian George Clooney.
Okay,
so,
how about that?
truly profound credentials. And
Okay.
I actually feel like I'm hosting the Oscars today. I introduced
Okay.
Steve Stout, Indian George Clooney.
Right.
We'll have to close the program up with Ryan Gosling or something.
Right. No.
So thank you, Aneesh, for being here today. Joining Aneesh in conversation will be his counterpart from the private sector, Glen Tullman, who is currently CEO of Livongo Health, a connected healthcare startup and Sapphire portfolio company that is seeking to revolutionize the way people manage chronic health conditions. Prior to founding Livongo, Glen was CEO of Allscripts, a company he turned around and took public in a very successful IPO in '99. Glen is a known innovator and leader in the healthcare space, and as such, I expect he's no stranger to life in a regulated field. Glen and Aneesh, the floor is yours.
All right, thank you. Hi, everybody. So Glen and I were, thank you so much for the introduction and also for inviting us to be a part of the conversation today. We had initially two main objectives. One is to share our respective stories about how we tried to bring some of the principles that you've been talking about all day in my world into the government, in Glen's world into the healthcare sector. But we also thought about sharing the results and the implications of this for how you might look at growth opportunities in these regulated markets. But Glen, that is not all we were going to do today. What else are we going to do?
Well, first of all, the Indian I'm presenting today, I'm going to tell my kids I presented with the Indian George Clooney.
Whatever.
And just, you know, what can you do? So one thing we thought we'd talk about, since Aneesh was the guy who was responsible for, was it Obamacare?
Oh, right,
so we
sure.
thought the technology
Wee little
piece
bit part of it.
And I wasn't on The Daily Show. I was on Fox News in between two people who were beating me up for my involvement in that. But we wanted to take a little poll. And that is, how many people think Obamacare is a good thing? Raise your hand if you think Obamacare is a good thing.
Half the room, right? Okay.
Okay, well,
a third,
surprising.
40%.
How many
That's better than more
people
than I
think
thought.
Obamacare was necessary?
Oh, that's good. Good
Okay.
line. Good line.
Okay. Okay, great. So I'm gonna make a little controversial statement. We'll come back to it, but we'll give a little bit of background, maybe historical briefing on some of the things that we both done to set the context. But I guess the statement I would make is whether you love or whether you hate Obamacare, it doesn't really matter. It was going to happen anyway. It could have been called Romney Care. It could have been called whatever. But what we have to do is we have to think back to the situation we were in. And the question is, could we have continued on the path we were in? And this whole discussion that we're going to have today is about disruption. And what's really fascinating is disruption is not normally run or led by the government. But I think we're seeing more and more disruption coming from the government, and we'll kind of challenge the group to talk about why that is. But Aneesh, why don't you maybe...
Well, thank you. We're going to get us started with a little bit of context. So the role that I filled was a role that did not exist in government prior to my serving in it. When President Obama was elected, he had campaigned on the idea that he'd wanted someone in his, basically his direct reports to speak the power, potential, and the possibilities of how technology, data, and innovation could advance the things that he cared most about for the country. And the assignment, in short, when he kind of more formally introduced the role, was to close the innovation gap because of exactly as the title described, the change that we've been talking about all day had not yet made its way into public sector departments. One quick story about it, just to give you, I had to be Senate confirmed, and my confirmation happened in May of 2009. Touch wood, it went just fine. But my first kind of assignment, if you will, was about a week and a half later. The president was trying to host, was hosting John McCain, and he wanted to break bread on the idea of an immigration reform breakthrough, basically. Can we reach consensus and put some bipartisan ideas forward? It was clear that it was not going to result in a breakthrough. So the chief of staff, Rahm Emanuel, about 36 hours before this summit, if you will, calls a few of us into the office and says, okay, so we're not going to have the policy breakthrough, but what can we do to improve the customer experience? I said, okay. I hadn't, at that moment, spent any time in the immigration department. I just presumed it would be as awful as you would imagine it would be, because people basically think it's like you go to this place to fill out your forms and you never hear from them again for many, many months. So we said, okay, what can we do in 36 hours to get something where the president can say, we're going to make a difference? And this notion of what it takes to be, I guess to some degree, this notion of disruption, air cover and or presidential leadership matters, because he decided to say, in 90 days, I'm challenging my team that we're going to rebuild this whole customer experience. And we had to prep for that because we knew that was coming, and we also wanted to get ourselves organized. At the time, the department was in a 5-year, billion-dollar, quote, transformation IT project with some big-name IT company, and I wanted to vomit when I got the briefing from them as to first deliverable that was consumer-facing would not have been for like year 2.5 or so. I mean, it was just mind-bogglingly goofy. And we walk in there and we say, okay, is this like literally how we're supposed to transform the organization? And long story short, we flipped the model and said, what would the consumers want? We actually listened to consumers, and it turned out that there were some basic things. Number one, Burger King had it right. Have it your way. Instead of you having to call the government or have your lawyer call, where's my file, where's my file? What if we could allow you to know where your file was by any means that you wished? If you want to have your lawyer call, great. If you want us to text message you to say you went from bin A to bin B, we'll do that. And you can also look it online. So step one was, okay, let's actually flip the model and make it push updates as opposed to making you come in when it's unknown. The second thing we thought we would do is to say, look, at the end of the day, the culture of the bureaucracy needs to move. We need to do something that would allow our own staff to realize that this change is coming. And so we said, what actually does it mean to be in bin A or bin B? How many bins does a form have to go through to get approved? And it's like literally hundreds. But they'd never thought about it, like, what are the categories of why we're in bin A or bin B? Some bins are because we're waiting on some Homeland Security clearance, and some bins are because you're supposed to send us a document and you didn't. We said, oh, why don't we disclose to the public, not just your file's ready, it's not, but here's where you are. And we said, okay, there's going to be 7 things that's going to happen to you. Are you in step 1 or 7? And people would have more transparency. So, okay, just think about it from the consumer standpoint. And then the last thing we said was, look, we got to benchmark our service centers because they had opportunity to perform differently. And this simple little framework went live in 90 days. Didn't cost us a significant amount of money. We've tried to reprogram some of the resources that were already there. And it changed the mindset about what was in the art of the possible. People felt that with air cover, they could start thinking about the consumer in mind. And so our strategy here was very, and by the way, the punchline of that was the Hispanic community, which had given us the lowest customer service rankings for how it was to deal with this particular agency, moved to the top 3 performing agencies just because they began listening and engaging. And this spirit and this idea was critical for how we would take this in each and every one of our departments. We'd have leadership that gave us air cover. We'd have an understanding of these new and emerging technologies that we could bring to bear with relatively simple ease. And then we want to basically establish kind of a lean startup mentality to make sure that the projects could be designed and executed one after the other. The punchline in all of this is that we now have a culture in the public sector, bipartisan culture. Nothing that we talked about was ever partisan. And it was basically the notion that we should actually start making this the default for how we would move the government. Cloud first, API first, data to the consumer, a whole series of key operating principles that we've now put into production. And I don't think, regardless of the election, they're going to change, because these are now embedded into the DNA. I shared that because as we get now into Glen's discussion about Obamacare, we clearly are also playing a role where the government has its own operational things to deal with, the website, healthcare.gov, et cetera. Some worked, some didn't. But we're also regulating large swaths of the economy. And that could be seen as good or bad. The setup conversation I had a few minutes ago with the Walgreens team was to basically set up this notion of, why are you doing such great work for people who want to shop for some wonderful thing in the store, like a better candy or something, but we're not going to use those same technologies to help people adhere to their medications so they can stay healthier, because we're afraid. So we then started putting in place rules and regulations that encouraged disruption. 3 small examples that I'm going to turn to Glen. 1, in healthcare, now it's the patient's right to be able to connect any application of their choice to their electronic health record data. No fees, no blocking, no burden. No government IT contract, no business associate agreements, no regulatory burden. Anyone that wants to be able to connect any app of their choice can go to their doctor and have that be made available on their portal. The regulations are final. It's going to take about 3 years to roll out, but now we know what the rules are. You heard earlier today about Nest and all the stuff that was happening with our home systems. Now, if you wanted to have Nest adjust the thermostat within a budget, where you had access to the smart meter that's now in your home, but owned by the utility and regulated, now you can, with no burden, connect your Nest thermostat to your smart meter, because we've created the Green Button Initiative, which requires that utilities do this. And then even on financial services, you should be able to take your checking account data and connect it to whomever you want. So this is the big picture of how we work to bring regulatory disruption inside the government and in the industries that we support. And Glen, tell me how you're feeling about all that on the healthcare side.
So, there's an interesting assumption, and the assumption is that private industry is head-to-head, head-butting versus the government, and in particular in healthcare, that's a challenge. And what's been interesting is we've seen almost the opposite, I think, if you really look and really understand what's been happening in healthcare. Because again, I would suggest to you that Obamacare, in a sense, is leading the consumerization of healthcare. Now, the problem is, anytime you disrupt the market, and I don't have to tell you guys this, it's messy, it's ugly, somebody's unhappy. So what's happening now? We're saying to a whole lot of people out there, you've got to pay the real cost of your health care, you've got to get involved. And when you put millions of people, when you say to millions of people, the first $5,000 is your money, you better believe, 1, they're going to be upset. 2, they're going to start to say, well, then I'm going to use my money differently than you would have used it. And we're seeing that happen. So let's talk a little bit about my background. So if you've ever had an automobile accident and they wrote an estimate using a computer, that was the first company that we invented. We went from paper-based to using technology to change a business process called electronic estimating. And then we went from there and we looked at healthcare and we said, hey, there's a similar thing going on in healthcare. We're writing more than 3 billion prescriptions written on paper, and we all joke about what? Physician handwriting, right? How hard it is to read. But what's no joke is the Institute of Medicine has said that more than 6,000 Americans per year die from preventable medication errors. Not from the stuff we can't prevent, not from stuff we don't know. This is preventable stuff. This is drug interaction. This is somebody prescribing 10 times the dose and nobody did drug to weight. Nobody did drug to pregnancy. So all stuff that seemed pretty easy. So we said, what would happen if we did the same thing we did for cars, if we treated people the same way? And it turned out that government regulation wasn't an issue. In fact, the administration at the time, and this was pre-Obama administration, supported by the Obama administration, put in place the predecessor, which was funding, to say we'll fund the promotion and adoption of electronic prescribing. And when you think about it, 6,000 Americans from bad handwriting and from stuff that's preventable, that's more people than we've lost in Iraq and Afghanistan. And so we knew using technology we could prevent that. The challenge actually wasn't the government. The government encouraged it with an incentive. The challenge was getting physicians to change their behavior. So all of you know this. You implement great projects at your companies, and it turns out the users don't want to change. And there's an old saying that says, some people see a rut and they want to furnish it. So, they were in a rut, they knew it wasn't great, but they actually didn't want to change. So fast forward, now that we had physicians starting to, and when I went to Allscripts, we pressed the button on the first electronic prescription that I think went to Walgreens from a physician office. And when I left, we were doing about 650 million. That's out of 3 billion. So there was still, and there still is even today, more than 10 years later, there's still work to do. But we went from there to saying, what if we could do an entire electronic medical record, but we soon changed that to an electronic health record because we said we have to do more than that. And the problem was, who's going to pay for it? How are you going to get this enormous industry, what I would argue will be the largest continuous growth industry in the world, called healthcare? How are you going to get it to move? And once again, we got help from an unlikely source, the government, with a $20 billion stimulus. $20 billion stimulus, and today, 90+% of our health records are electronic. Now, here's the challenge. The challenge is most people thought we were done. And all we did was, this was a necessary but not a sufficient condition. Because today, the big electronic health records are data repositories. They're not information systems yet. And there's another revolution coming. But if you didn't have that information, just like in your businesses, if it wasn't electronic, you couldn't start to address the problem. And healthcare is a problem that we fundamentally have to address together. Why? Because the better we get at it, the worse the problem gets. Well, what does that mean? That means the longer we keep you alive, the more you're going to need new hips, new arms, new shoulders, things repaired, and the more likely that you're going to have more and more diseases, especially chronic conditions. And the other problem is that you're going to want them all treated, and you all want to feel better than you ever felt before, because we all have the 10-year bonus, right? 50 is the new 40, 60, 50. Everybody picked up about 10 years from healthcare, where you see people. I had a director on my board, and he came in, and he was upset because his new hip, he was 72, said his new hip was affecting his golf game, and he was pissed. And I said, Phil, you're lucky to be alive, for God's sakes. You should be thanking the healthcare system. But his expectation of quality was so high. So what's the takeaway? Takeaway is that I think intelligent government can lead the way. I hope, and I would love it to come from private industry, from everybody here. And I think there's the opportunity to do that now. We're going to see it. Why? 2 reasons. One, the government is not going to have the money to do it. But we're going to have private industry start to lead the way in innovation. And that really speaks to a lot of you.
And I think here, the headline of the reason we brought these subjects up today is that if you look to the sectors in the economy where you will achieve growth, because I love that we can make photo AI work. That's awesome. But I'd also love for us to be able to detect cancer earlier or use these same capabilities on problems that have broader range. Today, they may not be seen as growth markets because there is a regulatory cloud. And the challenge is, how can the new capabilities that are available find ways to enter the market with the support of regulation as opposed to feeling that it's a barrier? In other words, why can't the next AI application be bent or focused on helping those at the very bottom of our economic ladder rise? And it can, and it hopefully will. Let me just share one because obviously you could tell I'm biased for President Obama, but the philosophical view here is one that was articulated by Herbert Hoover when he was Secretary of Commerce right after World War I. The U.S. led the way in aircraft production, but they were not commercially driven. It was driven by the government, World War I. So after the war ended, we stopped making contracts for aircraft, and the commercial sector hadn't quite felt comfortable buying a bunch of planes that weren't reliable. And the U.S. was feeling competitive threat because Europe was trying to invest in its own domestic airline sector. And Hoover had to face a choice. Bail out the U.S. industry, which is what they were asking for, or do nothing and watch it collapse. And instead, he changes the game and he says, why don't we think about a new model? He calls it the associative state. Why can't we find ways to come together and say, what are the common challenges and tackle them? Turns out we really didn't know how to make airfoils or engine cowlings quite well. So we funded the predecessor to NASA. We got industry and government engineers to work on this problem together and open source the findings. The DC-3 and the Boeing 247 became the two most successful aircraft of that era, and they shared the same IP. Now imagine in this radical radical personalization era, how do we do identity on the internet and verify that Aneesh is Aneesh and Glen is Glen? We don't have the right mix yet of identity proofing capability. We think we do, and vendors are trying to offer it, but we're not quite there yet. Public-private models are looking to get there right. Security on the cloud computing infrastructure. Another area where we can come together to work on standards. We launched a program called FedRAMP. I love this. We launched FedRAMP so it'd be easier for us to buy cloud technologies, but it worked so well, I think it did. A number of non-government entities are now requiring the FedRAMP certified products for them to purchase their own versions of those same cloud services. So it's sort of like we all benefit. So that's the point, Glen. I hope the message we're trying to convey is there's benefit in collaborating to make these disruptive technologies come to life faster. Is that fair?
There is, but I don't want to give, the reality is leadership, especially in technology, should come from the group sitting out here. It should not come from the government. And when the government needs to lead, that means this group isn't leading. Now, there's some good news here, and the good news is bad news. What does that mean? So my mother used to say that necessity is the mother of invention. So if we look across the board, I don't think there's any companies out there that say they can afford to buy their way out of the healthcare problem. We'll just continue to deal with 20 or 30% increases every year. The states can't do it. The federal government can't do it. So now we actually have to solve the problem. And how are we going to do that? And that's where technology comes in. So we have to get all the technologies we talked about today. We have to start to use those to fundamentally change, just like Herbert Hoover did. We have to fundamentally change how we approach this. And let me give you an example, and I'll use my current company called Livongo. And Livongo was based on a simple principle, and that is that if we take care of our cars, well, let's give a good example. So if you're driving a GM car and you have OnStar and you're in an accident, what happens? What happens?
Autotelemetry.
Autotelemetry. The car signals, sensors go off, and you get a phone call and someone says, Aneesh, are you okay?
Yep.
Right? Everybody knows that. So why can't we have OnStar for people? And that's what Livongo has done. What we've said is for people with diabetes, very simple, they're going to check their blood sugar. And if it's really high or really low, they're going to get a call within 60 seconds to say, how can we help? And that's a teachable moment. And right then, we changed the whole, exactly what happened. We changed the game. But we do more than that, because now we look at people and we say, today, who do you think goes to the doctor and schedules appointments at the doctor? Is it the most compliant people, or is it the least compliant people? Who schedules appointments? Most compliant? Raise your hand.
Most compliant.
Okay, least compliant? No, they don't do what you want. So we have all the healthy people going to the doctor, and then the doctors are upset. Why? Because they have the lowest billing code, because the people are healthy, so they can't bill. So now we have doctors upset. The payers are upset because they're saying we aren't changing the health of the population. Well, what if it worked the other way, as it does it with Mount Sinai, one of our customers in New York? They have a room full of people. They used to call people randomly and say, hi, we're Mount Sinai. We're committed to your health. Can we help? And the people would say, why'd you interrupt my day? And they'd hang up. And today they get a list every morning, and they say, here's the people who had a really rough night last night. Here's the people who really do need help. And when they call, those calls are welcome. They target, they come in, physician bills at a higher rate, but the physician does what he or she was trained to do, which is help sicker people. The population's getting healthier, payers are happy, and that's how it should work. All facilitated by technology. And so we have to start to use these great technologies. Now, what can all of you do? So the biggest challenge for smaller companies, if you talk to most of the startups here, they'll tell you that one of the big challenges, and we've been fortunate, we have just under half of the Fortune 50 who have adopted our stuff. Why? Because it's measurable and there's a clear return on investment. But even there, we have companies saying, what we'll do is we'll pilot. And so many of you have lots of pilots going on. And I would suggest that in the age of technology where things are moving so quickly, we have to start to leap before we look sometimes. We have to say, let's go with this, and if it doesn't work, we'll shut it down. But my partner likes to say that many of these companies have more pilots than United Airlines. And what we have to do is we have to get to a state where we're embracing technology, and that's what all of you do. And we have to start to say, we know the answer is here, and we're going to figure it out together, whether it's with the government or whether it's with a vendor. And we can bring scale these vendors, and we can lead. And that's where we have to get back to.
Glenn, there's a wall of, the problem that we face is that, going back to the discussion about, raise your hand, have any of you used the technologies you've got in a regulated sector? A couple of you. Where are you from? Narrative science. That's regulated. Narrative science. Narrative science. Oh, no, that's your company. Yeah, what sector? Financial services. Right. So one of the challenges is that there's a mentality, certainly in the IT departments at the regulated sectors, to effectively say no. Like, I don't know exactly the use case in financial services, but they're under these regulations for know your customer, so they have to really understand their customer. And anything that you do to disrupt that could create some tension in their ability. But here's an interesting scenario. When, as this healthcare transition's moving, in the law, Congress basically said, we want to hear from anyone that has a breakthrough idea on how we can change the care delivery system. And one of the ways they want to do that is they said, we're going to set up this legal framework for an innovation center. And if we can run a research study that says your approach, whatever the approach is, helps patients get healthier and keeps costs down, then we have the legal authority to scale up that intervention and make that publicly available without having to go back to Congress. Well, this wall of disbelief is that when this first came out, of course, I was like, I interacted with a lot of the tech companies, and they were always complaining, well, you don't reimburse digital medicine, telehealth isn't reimbursed, I can't, my fancy decision support tool in the patient's hands doesn't get any funding. I heard a lot of woe is me. Today, they announced the final rule to scale up one of the initiatives that came through this front door. Which organization in the United States was the first to take an idea through the Innovation Center and actually brought to life? What's the most technologically advanced company to have gotten through this process? It wasn't. It's the YMCA. The YMCA had the simple hypothesis. If we took people that were pre-diabetic and gave them 16 or 18 weeks of coaching and got them to be better in their lifestyle, we could achieve a return on investment. And the results came back 6-to-1 return on investment. And guess who benefited from the YMCA's proposal? What's the billion-dollar Silicon Valley startup going after this behavior change in digital health? Omada Health. Omada gets to piggyback off of the YMCA's engagement to develop a new reimbursement process for a breakthrough technology that actually has a return on investment. So what I would suggest is that, I remember vividly, early in my time, you talk to some of the major leaders in the industry that just don't look to see this. They're like, hey, if I think of the government, it's like regulator bad. All my cool stuff I'm going to do over here. And that mentality is constraining our ability to take advantage of these new services in ways that we think the patients of this country, not just in healthcare, but also energy consumers and education, all these regulated sectors, they can benefit. So Glenn, it's this wall of disbelief that I think we're going to have to break down so people feel like they can engage and benefit. And you've done it 4, 5, 6 times in all of your startups.
Well, I think we have to, one, hold the government to a higher standard. 2, I think we've seen progress in a number of government areas, but we all know there's plenty of work to do. And we also have to lead and push that. And we've seen that, within the diabetes space with the approval of the artificial pancreas, for example, which just happened for Medtronic. After years of work together, something that's a very dangerous regulated device, but yet pushing forward. And I think we see that across a number of them. What I'd like to do is stop and ask all of you if you have questions for Aneesh, tough questions, or for me, easier stuff. Otherwise, we'll call on people. It's the end of the day. Come on.
Yes, ma'am.
So what do you think the next turn of the crank is for Obamacare?
So care delivery reform. So all the news right now is that we've added all these folks to the rolls. And there's a political fight about the cost of that and the role of government. Now we're all 91% insured, okay? Now the question is, can we now move the delivery system so that we can actually go about the work of getting people healthier, doing that OnStar for patients? And I think the good news is this is the least partisan sort of part of Obamacare. It is the part that basically says we need to get into the business of running the equivalent of clinical trials, but for delivery models. So we could say, well, what happens if we, so another one that was announced today, a lot of folks with mental illness don't go to psychiatry. So there isn't like a good servicing system. Well, now there's a new code that was approved that came through one of these innovation programs that said, hey, if you go to your primary care doctor, they can partner with a psychiatrist who can review your chart, and that psychiatrist gets paid helping to review and manage you with a social worker in the middle. So we're going to see a pretty explosive growth between digital, non-digital, human interventions to get people into different programs, all focused on keeping them healthier. And that, over the next 5 years, is the hard work. Thankfully, that's approved under the law, although we need to fix some of the other things that are in it around the insurance piece. But that's my view, care delivery reform. How about you, Glenn?
I think that the best thing that's going to happen is it won't be Obamacare anymore. And that's become a lightning rod for saying it's good or it's bad. And the reality is when you get just one level down, everybody will say, well, do we want no pre-existing conditions? You know, everybody, 94% of Republicans and Democrats want that. Do we want coverage for children? Of course, everybody wanted it. You know, so there's a whole bunch of stuff that we all agree, and that is technically Obamacare. So once we get rid of the name, we can start to deal with the real problems. And the biggest problem for us is chronic conditions. So that is, it's weight management, it's hypertension, it's depression, and it's diabetes. And again, I think we can't just say, well, the government's going to take care of it. The government can lead the way. The government can set, some of it. And the government has started to reimburse things that make healthcare easier, like telehealth and other areas, which are great. But at the end of the day, the largest companies in this country and around the world are going to have to lead the way as well to say, we're going to demand from payers and from the healthcare system, we're going to demand transparency, which has been something big for Aneesh. We're going to demand we don't want to talk about patients. We want to talk about health consumers, okay? Because if you think about it, the minute we call someone a patient, everything gets bad. The minute we make them a consumer, look at everything that we've consumerized, okay? If every medical treatment that we've consumerized, cost has gone down, quality has gone up, and people are generally happy with it. Even they're happier with their veterinarians and their dentists than they are with healthcare, where generally they're paying full retail. If they're getting their eyes done, they're happy. If they're getting dermatology done, cosmetic surgery, happiness off the charts, and pretty high prices.
On that note, we're happiness for all as we get the boot at
That's
2
right.
minutes in.
We're getting
Thank
the
you,
boot.
guys.
Thanks.
Cheers.